One of the most important decisions in radiology is not just what we see, but how we choose to see it. That decision determines whether we use computed tomography, conventional radiography, fluoroscopy, or magnetic resonance imaging, and it directly influences how much radiation a patient receives. This is exactly what the Image Wisely initiative focuses on in adult medical imaging. Consider a patient who presents to the emergency department after a fall with severe lower extremity pain and an inability to bear weight. Computed tomography or CT could be used as it provides rapid cross-sectional imaging and detailed visualization of bone and surrounding soft tissue. It can help define fracture complexity, evaluate joint involvement, and clarify findings that may not be fully characterized on conventional radiography. However, CT exposes patients to more radiation than most other imaging exams and accounts for a substantial portion of total medical radiation exposure in the United States. This is why the decision to use CT should be deliberate and based on what information is truly needed. So the real question becomes, if conventional radiography can confirm a suspected fracture and both options are clinically appropriate, should we choose the higher dose CT exam? Conventional radiography uses significantly less radiation per exam than CT. Standard radiographs can confirm the presence and alignment of a fracture quickly, making them an appropriate first-line choice in many cases. When the diagnostic objective can be achieved with a lower dose study, selecting that option reflects responsible imaging practice. If the fracture is complex or involves joint surfaces, CT may still be necessary for surgical planning. That is when radiation exposure begins to accumulate across the stages of care. If surgery is required, intraoperative fluoroscopy may be used to guide fixation in real time. Fluoroscopy delivers radiation continuously while imaging is active, and repeated use during a procedure adds to total exposure. Over the full pathway, separate imaging decisions can add up to a meaningful cumulative dose. In some situations, magnetic resonance imaging may offer an alternative. MRI does not utilize ionizing radiation. When clinically appropriate, selecting a non-ionizing modality can reduce cumulative exposure while still answering the clinical question, particularly when soft tissue injury is part of the concern. In summary, from radiography to CT, fluoroscopy, and MRI, each imaging decision affects cumulative radiation exposure and reflects a deliberate clinical choice. This layered approach reflects the foundation of the Image Wisely initiative, led by the American College of Radiology, to promote appropriate imaging and reduce unnecessary radiation in adults. In radiology, the goal is not simply to see more, it is to see wisely.